Thank you for joining my presentation. Today we're going to be talking about emergency planning. Given our current situation with the pandemic, we thought this would be helpful for everyone. And the information we're going to discuss could also be useful for other situations. I know a while back we had a care partner who had to have emergency gallbladder surgery and found himself in need of some resources pretty quickly. So we hope that you will find this to be very helpful. One way that you can be prepared is to have a little to-go bag ready. And I laugh because it makes me think about the days when I was pregnant with my boys and just not sure when you'd have to go to the hospital. So I had a bag ready with all the important things I need. And some of the things that you would want in your to-go pack would be an updated medication list, your cell phone, and very importantly, your cell phone charger. The reason that's so important is because your loved ones are not able to visit you at the hospital right now. And so you definitely want to make sure that you're able to get in touch with them whenever you need to. And then you may have it already stored on your phone, your primary care physician's name and number, as well as your neurologist's and your insurance card. Many of you have had to go to the hospital, so you already know which hospital you prefer to go to. Just make sure that you know which hospital takes your insurance. And if you're not sure, you can always call the 1-800 number on the back of your card and they can tell you that. You'll definitely want a way to keep in touch with all your friends and family. So you might consider creating a phone tree or an email list that you can just easily send out one message and everybody will get updated on where you're at, how things are going. Especially if you live alone, that's important. So it's very good for you, the care partner, and you, our member with MS, to talk to each other and make this plan together. One question I would ask is, who has a key to your house? Or who besides the two of you can get in? Judy had a good recommendation at her house. She has a keypad on the entry door that can be programmed. She said that they've used it for different servicemen, plumbers or contractors who had to come in to get a job done, and you can give them a special number, and then as soon as you're done with their services, that can be deleted. So you might consider that. The next document is so important. I cannot stress it enough. I worked in hospice for 10 years, and I think everyone should have an advance directive. It's also called a healthcare treatment directive. And that lets you spell out what your wishes would be if for some reason you became unable to make your own decisions. And it will ask you about things like artificial nutrition, feeding tubes, resuscitation. And so just know what your thoughts are on that. And you can always talk to your primary care doctor if you have more questions or want to get his or her recommendation. Part of the advance directive is selecting a durable power of attorney. And durable means it only goes into effect if you are unable to make decisions for yourself. And you can also put more than one person. You can have your primary DPOA, and then you can have an alternate. And having that document is good for now. It's good for situations that can come up down the road. And you can always have changes of opinion about your advance directive, and you can edit those as much as you like. In the state of Kansas, you just have to have 2 witnesses sign it. It does not have to be notarized. In Missouri, you do need a notary. And if you have these documents, make sure your family members know about it and have it in a place where it's easily accessible. So when you think about what your discharge plan would be from the hospital, you want to think about what different rehab facilities there are. And you can certainly advocate to go to a particular one. Of course, it'll depend a lot on their availability if they have spots, but having a familiarity with those places is good, because then you can actively plan for the discharge. And usually the hospital social workers are kind of the person that you would want to talk to and collaborate with. I think, again, if you live alone, you'll need to think about, are there extra supports that you're going to need when you get back there? Things for the care partners to think about. I would go through a typical day, think about the routine that you guys have, and what are all of the activities of daily living. You know, medications, what's given at what time, meals, bathing, all of that. You know, are there some things that your loved one can do on their own, or is this going to be, are they going to need full-time support? Sometimes people just kind of have to piece it together, where family can do a few hours, and then they may hire caregivers to come in for a couple hours a day, that sort of thing. And I would definitely have this written up and put it with your other important documents to make sure your family knows where it is located. Also, considering your support system. Think about everyone: church members, neighbors, family, friends. Now is the time to not be shy. And, you know, people, if they have offered help in the past, then I would definitely take them up on it. And remember, it is not breaking quarantine to have someone come into your home to provide care needs. One website that I really like is Caring Bridge. It's a way to keep everybody in the loop. And you can either be the author of the posts, or you can have a designated friend or family person do the writing for you, so that they can tell everybody about your progress, and that saves you from having to field many texts and phone calls, and it's just a great way to keep people in the loop. Meal Train is a wonderful website in which your friends and family can sign up to bring you meals, and it allows you to pick what days or times are the best, and if you have any dietary restrictions, you can keep note of that. An app that I really like is called Nextdoor. It's a way to keep you connected to your neighbors, and if you have any particular needs that come up, you know, if you need someone to get your mail or take your trash out or maybe mow, then this would be a great resource for that sort of thing. You can just post what you're needing help with, and generally there's always some good-hearted people out there looking to do some volunteer work. Other things to consider. It's really important to have some knowledge of what kinds of facilities are available, as well as in-home caregiving agencies. Some people confuse the terms home health and private duty. Home health is very specified. It is for a skilled need. And generally, you get home health after you discharge from the hospital. So that would be something that your doctor would order. Private duty caregiving is where you hire someone, it could be a nurse, it could be a CNA, to come in and help with those activities of daily living. Assisted living would be for someone who can do certain things on their own, so you still have some independence. And long-term care is if you need help with almost all of your activities of daily living. And then someone had asked when I did this presentation if in-home caregiving agencies are still, if they'll still come to your home if there's if there's been exposure to COVID. And the answer is yes. These companies, they want to stay in business and they are trying to keep working, so they are taking every precaution. They have strict guidelines about the personal protective equipment, PPE, that they have to wear, sanitation processes where they wipe down all their equipment before they come in and when they leave. And when you call an in-home caregiver, or I'm sorry, private duty caregiving company, you can ask them all about their protocols, and they'll be more than glad to tell you what they're doing to keep their patients safe. It's really important to have an understanding of your financial situation, because unfortunately, these options are not, they're not very cheap. In-home caregiving generally is about $22 an hour. Assisted living is about $180 a day, and long-term care can cost anywhere from $150 upwards of $300 a day. And Medicaid does help with nursing home costs. Unfortunately, Medicare only pays for skilled nursing. And what that is again, a specific need. If you've been in the hospital and then you get discharged and like you need rehab, something like that. Some people have long-term care policies, which is basically an insurance policy for the facility. And again, Medicaid, as I mentioned before, Medicaid also has a component where they can reimburse individuals to provide in-home care, as long as the person receiving the care is able to direct the care. Again, as we talked earlier about possibly having to go to rehab, know where you would want to go, and just think about ways that your family and friends can help you. The next slide is about some resources. United Way 211, they have a vast knowledge of all the nonprofits in the KC metro area, and I've called them for a variety of things, asking if they have any folks that do in-home repairs, anything you can think of, meal deliveries, that kind of thing. And all you have to dial is 211 and tell them kind of what you're looking for. And generally they can give you the names of a couple nonprofit agencies that can help with what you're looking for. There is a good resource group on Facebook. It's called Pandemic Partners Kansas. And it's just a way to connect these nonprofit agencies with the community and, you know, making sure that people know what's available. So again, you can get on there and ask about any of those things. The Sister Servants of Mary is a neat program based out of Kansas City, Kansas, and it's an order of nuns who are medically trained, and they're able to come and sit with patients between the hours of, I believe it's 9 p.m. to 5 a.m. And you do not have to pay for that. The only thing you do have to do is provide their transportation. And even if you're not able to physically go pick them up, you could still just hire like an Uber, or they have a taxi service that they use. Joe is his name, this guy who's worked with them for many years and gives them a discounted rate. And then again, as we talked earlier about healthcare treatment directives or advanced directives, you can go to the website for the Center of Bioethics, and I listed it there on the screen for you. And you can just print that form off. It's only 2 pages. And again, in Kansas, you don't have to have a notary if you have the 2 witnesses. In Missouri, you do have to have a notary, but there are some notaries that will make home visits. I know sometimes banks will do it if you're able to get there. And then, as I stressed before, it's so important for you to be knowledgeable of what assisted living facilities, in-home care agencies, or long-term care facilities you like, just in case you ever needed to know that. It's always better if you get some say in where you're going to be going. And so at least if you had maybe 3 places that you felt good about, then you could check those places first should an emergency arise. There's a couple ways that you can check out facilities. Obviously at this time, you're not really able to go do tours, but there's a lot of internet research you can do and reading reviews. Medicare is one of the best ways to kind of evaluate a facility, and they have their own website. So they do a lot of surveys, and anytime a nursing facility gets a deficiency, they have to put it on the website. So I think that's a good one. And then there's a resource called Senior Blue Book. I used to get printed versions of those. I don't know if they still print them, but they also have a website too. Just keep in mind though that because a facility is featured and has pretty pictures, does not necessarily mean it's an endorsement. You know, in my experience working in facilities, sometimes the fanciest pretty ones didn't always give the best care. And then there were other places that didn't really look all that nice, maybe from the outside, but you walked in, they smelled clean, very caring staff. I really kind of like the small town nursing facilities. Sometimes I think that they're able to give a little bit better care just because they usually they have less turnover with staff and things like that. And then obviously you guys can always ask me if I've heard anything good or bad about a facility you might be looking at. I worked with many in my years of hospice. And that brings us to our last slide. The one question someone had brought up when I did my presentation was, are there any programs for pets? Like if someone should go into the hospital and they didn't have someone to look after their animal. I've contacted a couple groups to find out the answer to that. I'm sure that there are some programs, I just don't know what they are off the top of my head. Feel free to call me or email me if you think of anything else, and I'm always here for you as a resource. Thank you so much.